Hello, how are you? My name is Larry Arnn, and I'm going to start with how the pandemic policies look down on the ground. Because I live in Hillsdale, Michigan, which is a little town in south central Michigan. And it's, we know each other, right? The police and the prosecutor and the judges and the mayor and the business people, we all know each other. And so there's this thing going on that's amazing. First of all, a lot of people in our town, a lot of people in our college have had the coronavirus. One person, a retired person, has died from it. Thank God there aren't more. But constantly, the rules become more systematic. Not more clear, more systematic. So just last week, two people in my employ got a letter from a woman who's the health director in the Tri-County area. That's seated in Coldwater, Michigan, 30 miles away, population about 15,000. And the letter says, you've tested positive for COVID, and you're required, what it doesn't say is you've tested positive for COVID. I hope you're getting better, and if you need any help, call. It doesn't say that. It says you're required to quarantine, and if you violate the quarantine, we will put a motion in court to take you into protective custody. So threatened with arrest. And I like that expression, protective custody, because it's actually a reversal of what the name means in law. Protective custody means we take you into custody to protect you. No, now we're going to confine you to protect others, I guess. So they got a letter from the health department, long letter, by the way, it took forever to say, that's about all it says, and threatening. And the letter arrived, in both cases, precisely 5 days after their quarantines were completed. So, incompetent and hostile at the same time. Now, why would it happen that somebody in a little town near here could write letters like that to citizens? Well, I can maybe explain that. And you have to sort of walk your way up a chain. The next thing up the chain is the Lansing, Michigan Department of Public Health, appointed by the governor. And they are in control of this thing now. But it's an interesting story how it came to be. First of all, there's this emergency declared. And the governor of Michigan, Governor Whitmer, and we've had, pretty bad COVID experience in Michigan. There's a 1970-some Emergency Act in Michigan, and it says that the governor can declare a state of emergency, and then she's got to go talk to the legislator about it every 30 days to extend it. And they can have some influence on what the policies are. And so she relied on that law, which means that she knows what that law is and endorses it, until the third time she asked for an extension when the legislature didn't give it. And so then she went back to a 1947 law. The 1947 law just basically gives her plenary power for as long as she wants. And so she didn't rely on that at first. She relied on the more modern thing, and a reasonable person might think it was superseded. And so away she goes, and then she gets sued by many people. And it gets to the Supreme Court of the state of Michigan, and darned if they don't rule that she is acting as the legislature as well as the executive, and that is unconstitutional under the Michigan and federal constitutions. If those constitutions mean anything, they mean that. And so it was struck down. Amazing. The person who wrote the opinion is a man named Steve Markman, a great man who teaches law part-time here at Hillsdale College. And he's now retired, by the way, and the majority on the court has changed. It was uncertain before. Now it's not uncertain. And so she condemned the decision. Now, was she acting as a legislature? The facts, frequently asked questions that are published to explain her rules, have more than 1,000 points in them. And the rules just are innumerable and changed all the time. And they have lots of idiocies in it, like she decided that people should not be allowed, this is in the spring, to buy seeds. So they could go to the store and buy a garden hoe, but they couldn't buy seeds. All the while she's saying that she's relying on the experts. When the Supreme Court struck down her orders, the ones made after the legislature didn't grant her an extension, she immediately delegated all of the same powers to the Michigan Department of Health, an executive agency, really a bureaucracy, reporting to the governor. And they immediately reissued all the same rules. Now, first of all, a court has said that you can't be both the legislature and the executive, you, the governor, an elected official. So her opinion is, well, these bureaucrats can do it. They have more power than I do. And so that's what they do now. And, the college, Hillsdale College is 175 years old. It's been shut down twice in its history, both in the last 8 months. Not in the Civil War, not in the Great Depression, not in the World Wars. So what's to be done about that? Well, it goes on, right? How did we get started on this path? Because, I study politics and history, and so I look at it that way. I have the honor not to be an expert on the virus or any such thing. I understand you have the very great Jay Bhattacharya there, and he is an expert. But I think about how do you make laws and who makes them? And so what happened was when this pandemic hit, the Centers for Disease Control, which I'm told has 22,000 employees and one political appointee, that is, one person accountable to the people of the United States, they called it a terrible emergency, and they called for lockdowns and all kinds of things, temporary, in order to save hospitals from being overwhelmed. If anybody, any politician, were to defy them in any way, then they will be pilloried in the press, as every governor who has defied them has done. And I think this appealing to experts is this is my penultimate point. My appealing to experts is a very interesting thing to do, because when we do that, we don't understand how practical judgment works. We can't if we do that. And here's why. There are, I understand now, tens of thousands of medical professionals and researchers who have endorsed the Great Barrington Declaration. They're a bunch of experts. There's also some large number that has signed a document in opposition to it. And that's what proves my point. Winston Churchill, whom I've studied a lot and who's wise for things like this especially, he was in charge in high office, let's say, and once prime minister, in the two greatest wars in history. And he also had very distinguished military service of his own. And through both of those wars, and in peacetime too, he was always sitting in rooms with generals. And they are experts in war. And the interesting thing about them is they never agreed. There was never a day where they all walked in and they had some difficult thing to decide, and at the beginning of the meeting, everyone was in agreement. Now, our governor, who says, I'm just following the experts, it's not true. She's following some of the experts and not others. And that means that judgment is not being made by an expert. It's being made by a governor. And that's how it should be and must be, except that my view is the governor should say that's what she's doing. And then she could articulate how, knowing that there are these differences of opinion among scientists, I have to weigh all of the factors. The head of the CDC said in early August, if I remember the time right, that in the last 2 months there had been more deaths from extra suicides than from COVID. Now, suicide's a terrible way to die. And so we're killing people. What does that matter? Who's to stop that? Well, public officials are supposed to do it, except they have ceded control to the experts. And it's interesting that the expert advice that they pick consistently, in most states, many anyway, is advice that makes them the center of everything and very powerful. So that's, in our college, when we were shut down, first of all, there's an argument about whether there are lingering long-term effects on young people of contracting the virus. And I don't know anything about that except that I think those arguments would be very hard to settle in the short term. But if there's just a danger of that, or just some sign of that, then what would be the cure? Would it be to keep them home until the virus is gone? But then you're sacrificing important years in their lives. Right now, 18, 19, 20, and 21-year-olds, if they're bright and ambitious and want to know, it's the perfect time for them to engage in intense education. And that is best, according to the old wisdom in the history of liberal education, best done together and closely. And that is disrupted. And that's a cost. And it's a serious cost. We do more counseling with kids now than we normally do. Then that cost is just the same as the local businesses around here. And we know them. And what's to stop it? Because our fundamental rights, what are our fundamental rights? Do you ever think, why is the First Amendment first? It's about direct operations of the rational human soul. Only the rational human soul can talk, or worship, or assemble to talk, or petition others in the Bill of Rights, right? Those are absolutely crucial, and they are closely related to us being what we are. And those are things that are being disrupted. And then what about the right to make a living? I propounded a rule that I put about for a long time because, as you know, I'm a health expert. I said, if you stop people from making a living, they will die. That's why we call it a living. If you interfere with people's, like churches, right? In California, they were stopping churches and they were letting casinos stay open. Those are revenue sources for the government, by the way. So all of this is partial and bureaucratic and ugly and difficult. And the great epidemiologist and medical doctor that I mentioned earlier lately is quoted to have said that this is one of the greatest failures of imagination in American history. I think it is. But I think it's more dangerous than that, too. And I think it's time to find a way to get this stopped. And I wish you well with your conference.